numbers of those people here in Pitt County, Greene County, all across this region. Very large numbers of working adults who do not have sufficient income to ever purchase health insurance and will never be eligible for Medicaid.
With this economic situation we've had recently, we've had a lot of folks who used to be well insured, who've lost a job or lost their insurance.
And many times, as I say, it's very difficult for them to ask for help. Patients will say that they've always been self-reliant. Maybe they were just living from paycheck to paycheck, but they were managing. Suddenly, those things are really at a critical point, and then their health is making those financial situations even worse.
They're coming in because a health problem has derailed their lives.
Really all backgrounds. We've seen there's some people that have worked that now have maybe been hurt on the job or have developed certain issues.
Dealing with poorer patients can be very difficult and frustrating for physicians because they may not have the resources, they may not have the health quality education to really understand where to go from here, whereas the MEND social work and nursing aspect can kind of fill in that gap.
That's the basis of the whole idea, is that it will address a continuum of care that will allow us to use our assistance funds more effectively, and that will be a way that we can immediately access people who are coming to us for assistance.
To me, it just makes a difference in people's life. You see where some people are so depressed and they are in crisis mode, and we're able to alleviate just a little bit off them just by saying, okay, we can help you with this.
So if we can make that simpler, we know we can help long-term problems, long-term chronic problems that ultimately cost people lots of money, it costs them their lives, it costs them disability. And so if we can help that'll be the true fruit of the program, if we can help those people through those problems.
What the MEND program will allow is for them to coordinate their care so that they will be able to address the underlying medical issue and get back to work.
It originally came from the faith community saying, we don't know what we're doing here by giving out this money for healthcare issues. They didn't know whether they were spending their money appropriately, and they wanted some advice on that.
This will give us one place that we can send them to and say, this is where you need to go to get this assistance. The second thing that will help with us anyway is that it will help us to maximize the use of the funds that we have.
Well, the MEND project is a way of providers being able to help patients who are in need or in assistance for all kinds of reasons, whether it's financial, whether it's not being able to navigate the system. It's a way of helping those patients navigate the healthcare system.
To me, it means that I can be a good steward of the funds that people here contribute for the purpose of helping people.
Dollars and cents didn't have anything to do with the people that came into my life. It was the caring people that they had working for them. You know, they saw that I needed help, and they put me in the right path to get the help that I needed, free of charge.
For me, this is a chance to give, and you can't do it alone. Nothing for which I've ever been credited is something I did. It's what a group of people did. And what we've been able to do by bringing together people is to make it work. And for me, that's extremely gratifying.
They really helped me out a lot.